Cisatracurium. Expanded lecture notes. Cisatracurium is a muscle relaxant used in anesthesia. It helps with intubation and keeps muscles relaxed during surgery or on a ventilator. Works by blocking acetylcholine receptors. Broken down in the body by a chemical process, Hoffman elimination. Useful in patients with liver or kidney issues. Effects can be reversed when needed. Introduction to Cisatracurium. 1. Cisatracurium is a non-depolarizing neuromuscular blocker. This means it helps relax muscles by blocking nerve signals. It belongs to the benzylacetoquinolinium class. This is a group of drugs with similar chemical structures. 2. Cisatracurium is a stereoisomer of Atracurium. This means it's a mirror image version of Atracurium with some differences in effects. Cisatracurium has less histamine release and greater potency compared to Atracurium. Less histamine release means fewer side effects like low blood pressure. 3. Like Atracurium, Cisatracurium is metabolized primarily by Hoffman elimination. This breakdown process doesn't depend on liver or kidney function. 4. These properties make Cisatracurium valuable for prolonged paralysis in ICU patients with multi-organ failure. This means it's useful in critical care for patients with problems in multiple organs. Definition. Cisatracurium is a competitive antagonist at nicotinic acetylcholine receptors in the neuromuscular junction, producing skeletal muscle paralysis without depolarization or fasciculations. 1. Cisatracurium is a competitive antagonist. This means it competes with acetylcholine for receptor sites. 2. It acts at nicotinic acetylcholine receptors. These receptors are found in the neuromuscular junction where nerves talk to muscles. 3. In the neuromuscular junction, Cisatracurium blocks acetylcholine's action. This leads to muscle relaxation. 4. Cisatracurium produces skeletal muscle paralysis. This means it causes muscles to relax or not move. 5. It does this without depolarization. Depolarization is a different way some muscle relaxants work, causing brief muscle twitches, fasciculation. 6. And without fasciculations. Fasciculations are small, brief muscle twitches sometimes seen with other types of muscle relaxants. History of Cisatracurium. 1. Cisatracurium was developed as one of the 10 stereoisomers of Atracurium. Stereoisomers are different forms of a molecule with the same formula but different arrangements. This development happened in the 1990s. This was a period finding drugs for better effects and fewer side effects. 2. Cisatracurium was introduced into clinical use in 1995. This means it started being used in medical settings for patient care. 3. It was designed to retain the beneficial pharmacokinetics of Atracurium. Pharmacokinetics refers to how a drug is absorbed, broken down, and removed by the body, while reducing histamine-mediated cardiovascular effects. Histamine release can cause side effects like low blood pressure or flushing, and reducing laudanosine production. Laudanosine, breakdown product of Atracurium that has potential side effects. Cisatracurium produces less of it. Classification of Cisatracurium. 1. Pharmacological class. Non-depolarizing neuromuscular blocker. This means Cisatracurium blocks nerve signals to muscles without causing initial muscle twitching. 2. Therapeutic class. Skeletal muscle relaxant. This indicates Cisatracurium is used to relax skeletal muscles during medical procedures. Benzylacetoquinolinium type. This refers to the chemical structure of Cisatracurium, grouping it with similar drugs. Chemical properties of Cisatracurium. 1. Chemical name. 1R, 1 foot R, 2R, 2 feet R, 1, 1 foot biphenyl -2, 2 feet dialbus 3, 4 dimethoxyphenyl methyl -6, 7 dimethoxyisoquinoline ester. This is the specific chemical naming for Cisatracurium based on its structure. 2. Molecular formula. CHNO. This represents the composition of atoms in a molecule of Cisatracurium. 3. Molecular weight. Approximately 1,203.4 grams per mole. This is the approximate mass of a molecule of Cisatracurium. 4. Structure. 1 of 10 stereoisomers of Atracurium, the most potent one. Cisatracurium is a specific isomer of Atracurium and is more potent than other isomers. 5. pKa. Approximately 8.5. The pKa value indicates the acidity-basicity of Cisatracurium, affecting how it behaves in the body. Physical properties of Cisatracurium. 1. Appearance. Clear, colorless to slightly yellow aqueous solution. This describes how Cisatracurium looks in its liquid form. 2. Solubility. Freely soluble in water. This means Cisatracurium dissolves easily in water. 3. Formulation. Supplied as Cisatracurium benzoate for IV injection. This is the form of the drug used for injection into a vein. 4. Stability. Store at 2 to 8 degrees Celsius. This means Cisatracurium should be kept refrigerated for best storage. Stable at room temperature for up to 21 days. This means Cisatracurium can be kept out of the fridge for up to 21 days without losing effectiveness. Mechanism of action of Cisatracurium. 1. Binds competitively to nicotinic acetylcholine receptors. Cisatracurium competes with acetylcholine for these receptor sites at the neuromuscular junction. At the neuromuscular junction, preventing acetylcholine from initiating depolarization. This stops the muscle from contracting. 2. Produces paralysis without fasciculations. Fasciculations are small muscle twitches seen with some other muscle relaxants. Without potassium release. Some muscle relaxants cause potassium to be released into the blood. Cisatracurium doesn't do this much. 3. Blockade reversed by acetylcholinesterase inhibitors, e.g., neostigmine. These drugs help reverse Cisatracurium's effects by increasing acetylcholine levels. Or spontaneously via Hofmann elimination. Cisatracurium breaks down naturally through this chemical process, helping to end its effects. Pharmacokinetics of Cisatracurium. 1. Onset. 2 to 3 minutes intubating dose. This is how long it takes for Cisatracurium to start working for intubation. 2. Peak effect. 3 to 5 minutes. This is when Cisatracurium's effect is strongest. 3. Duration. 30 to 50 minutes. This is how long Cisatracurium's muscle relaxation lasts. 4. Metabolism. 1. Primary. Hofmann elimination. This is the main way Cisatracurium breaks down in the body, and it's affected by pH and temperature. 2. Secondary. Ester hydrolysis by plasma esterases. This is a lesser pathway for Cisatracurium breakdown. 5. Elimination. Organ independent. Cisatracurium's breakdown doesn't rely much on liver or kidney function. An active metabolite excreted in urine and bile. The broken down parts of Cisatracurium leave the body through urine and bile. 6. Half-life. 22 to 29 minutes. This is how long it takes for Cisatracurium levels to reduce by half in the body. Not significantly altered by renal hepatic failure. This means Cisatracurium's breakdown isn't much affected by kidney or liver problems. Pharmacodynamics of Cisatracurium. 1. Produces consistent muscle relaxation. Cisatracurium provides reliable muscle relaxation for medical procedures. 2. Minimal histamine release. Cisatracurium doesn't cause much histamine to be released in the body. Low risk of hypotension or bronchospasm. Because of minimal histamine release, Cisatracurium has a low risk of causing low blood pressure or airway narrowing. 3. Minimal cumulative effect with prolonged infusion. This means Cisatracurium doesn't build up much effect over time if given continuously. Storage and disposal of Cisatracurium. 1. Store refrigerated at 2 to 8 degrees Celsius. Cisatracurium should be kept in the fridge for best storage. 2. Stable for up to 21 days at room temperature after removal from refrigeration. Cisatracurium can be kept out of the fridge for up to 21 days without losing effectiveness. 3. Dispose of unused solution according to hazardous waste protocols. Unused Cisatracurium should be thrown away following rules for hazardous medical waste. Interactions of Cisatracurium. 1. Potentiated by volatile anesthetics. These anesthetics can increase Cisatracurium's muscle relaxation effect. Potentiated by aminoglycosides. Certain antibiotics like aminoglycosides can enhance Cisatracurium's effect. Potentiated by magnesium, lithium. These substances can increase the effect of Cisatracurium. 2. Antagonized by cholinesterase inhibitors, unless used for reversal. Drugs that increase acetylcholine can counteract Cisatracurium, except used to reverse Cisatracurium's effects. 3. Additive effects with other NMBs. Using Cisatracurium with other neuromuscular blocking agents can increase muscle relaxation effects. Clinical uses of Cisatracurium. 1. Facilitation of endotracheal intubation in elective cases. Cisatracurium helps relax muscles for breathing tube placement in planned surgeries. 2. Skeletal muscle relaxation during surgery. Cisatracurium is used to relax muscles during operations. 3. Long-term neuromuscular blockade in ICU patients with multi-organ failure. Cisatracurium is useful in critical care for patients with problems in multiple organs. 4. Safe option for patients with significant hepatorenal impairment. Because Cisatracurium breaks down independently of liver and kidney function, it's safe for patients with problems in these organs. Use of Cisatracurium in ICU. 1. Preferred NMBA for prolonged paralysis in mechanically ventilated patients, e.g., ARDS. Cisatracurium is often chosen for long-term muscle relaxation in ICU patients on ventilators, like those with acute respiratory distress syndrome. 2. Predictable metabolism avoids drug accumulation in organ failure. Cisatracurium's breakdown is reliable even when patients have liver or kidney problems. 3. Associated with fewer histamine-related hemodynamic changes compared to Atracurium. Cisatracurium causes fewer side effects like low blood pressure due to less histamine release compared to Atracurium. Use of Cisatracurium in anesthesia. 1. Suitable for most surgical procedures requiring muscle relaxation. Cisatracurium can be used for muscle relaxation in many types of surgeries. 2. Useful in cardiovascularly unstable patients. Cisatracurium is a good choice for patients with unstable heart or blood vessel conditions because it causes minimal histamine release. 3. Advantage in patients with severe organ dysfunction. Cisatracurium's breakdown doesn't depend much on liver or kidney function, making it useful for patients with severe problems in these organs. Use of Cisatracurium in emergencies. 1. Can be used for urgent intubation. Cisatracurium can help with breathing tube placement in urgent situations, but slower onset than succinylcholine or high-dose rocuronium. Cisatracurium takes a bit longer to work compared to these other fast-acting muscle relaxants. Makes it less ideal for true RSI. Rapid sequence intubation needs fast-acting drugs. Cisatracurium isn't the best for this. 2. More suited for maintenance of paralysis after airway is secured. Cisatracurium is used for keeping muscles relaxed after the breathing tube is safely placed. Administration and dosage of Cisatracurium. 1. Adults. 1. Intubation. 0.15–0.2 mg per kilogram IV. This is the typical dose for muscle relaxation to help with breathing tube placement. 3 times E95. This dose is about 3 times the effective dose for 95% of people. 2. Maintenance. 0.03 mg per kilogram IV bolus. This is a dose for additional muscle relaxation as needed. Or infusion 1 to 3 microgram kilogram per minute. Cisatracurium can be given continuously at this rate for ongoing muscle relaxation. 2. Children. Similar milligram per kilogram dosing. Kids generally get doses like adults based on weight. Neonates may have slightly prolonged duration. Newborns might have Cisatracurium's effects lasting a bit longer. Side effects of Cisatracurium. 1. Mild injection site discomfort. Some people might feel slight discomfort where Cisatracurium is injected. 2. Transient hypotension, rare. Low blood pressure can happen briefly but is uncommon with Cisatracurium. 3. Minimal bronchospasm, very rare. Narrowing of the airways is a very rare side effect with Cisatracurium. Serious side effects of Cisatracurium. 1. Anaphylaxis, rare. A severe allergic reaction can happen but is uncommon with Cisatracurium. 2. Residual paralysis if not fully reversed. If Cisatracurium's effects aren't fully reversed, muscle weakness can occur. 3. Accumulation of laudanosine, minimal compared to Atracurium, rarely clinically significant. Laudanosine is a breakdown product. Cisatracurium produces less of it than Atracurium, and it's rarely a problem. Contraindications of Cisatracurium. 1. Known hypersensitivity to Cisatracurium or other benzylacetoquinolineium NMBs. Cisatracurium shouldn't be used if someone's allergic to it or similar drugs. 2. Need for extremely rapid onset of paralysis (RSI) without pre-optimization. Cisatracurium isn't ideal for rapid sequence intubation needing very fast action because it has a slower onset compared to some other drugs. Precautions with Cisatracurium. 1. Avoid hypothermia and severe alkalosis, acidosis, may alter Hoffman elimination rate. Body temperature and acid-base balance can affect how Cisatracurium breaks down. 2. Use neuromuscular monitoring to titrate dose accurately. Checking muscle response helps adjust Cisatracurium dosing correctly. 3. Prolonged ICU use may still contribute to ICU-acquired weakness. Long-term use of Cisatracurium in ICU might contribute to muscle weakness seen in critically ill patients. Advantages of Cisatracurium. 1. Organ-independent metabolism. Cisatracurium breaks down without relying much on liver or kidney function. 2. Minimal histamine release and hemodynamic changes. Cisatracurium causes few side effects like low blood pressure due to minimal histamine release. 3. Less laudanosine production than Atracurium. Cisatracurium produces less of a potentially problematic breakdown product compared to Atracurium. 4. Predictable recovery profile. Cisatracurium's effects wear off in a predictable way. Disadvantages of Cisatracurium. 1. Slower onset than succinylcholine or RSI dose rocuronium. Cisatracurium takes longer to work compared to these fast-acting muscle relaxants used for rapid sequence intubation. 2. Higher cost than Atracurium in many settings. Cisatracurium can be more expensive than Atracurium in some places. 3. Requires refrigeration. Cisatracurium needs to be kept cold to stay effective. Clinical considerations for Cisatracurium. B1. Best for ICU patients with multi-organ failure needing prolonged paralysis. Cisatracurium is a good choice for long-term muscle relaxation in critically ill ICU patients with problems in multiple organs. 2. Ideal when minimal cardiovascular disturbance is desired. Cisatracurium causes minimal effects on heart and blood vessels. 3. Monitor neuromuscular function to prevent prolonged blockade. Checking muscle response helps avoid lingering muscle weakness after Cisatracurium use. Comparison of Cisatracurium with other agents. Cisatracurium, Onset IV, 2 to 3 minutes. Duration, 30 to 50 minutes. Metabolism. Hoffman elimination plus some ester breakdown. Organ dependence. Number. Histamine release. Minimal. Laudanosine production. Low. Atracurium. Onset IV 2 to 3 minutes. Duration 20 to 35 minutes. Metabolism. Hoffman elimination plus ester hydrolysis. Organ dependence. Number. Histamine release. Mild. Laudanosine production. Higher than Cisatracurium. Rocuronium. Onset IV 60 to 90 seconds. Duration 30 to 60 minutes. Metabolism. Minimal hepatic metabolism. Organ dependence. Minimal. Histamine release. Number. Laudanosine production. None. Succinylcholine. Onset IV 30 to 60 seconds. Duration 5 to 10 minutes. Metabolism. Broken down by plasma cholinesterase. Organ dependence. No. Histamine release. No. Laudanosine production. None. Additional information. About Cisatracurium. 1. 3 times more potent than Atracurium. Lower doses needed for same effect. Cisatracurium is more potent than Atracurium, so less of it is needed for muscle relaxation. 2. More stable hemodynamically, making it suitable for cardiac surgery patients. Cisatracurium causes minimal changes in heart and blood vessel function, making it a good choice for heart surgeries. 3. Often included in ARDS ventilation protocols in ICU. Cisatracurium may be used in patients with acute respiratory distress syndrome (ARDS) in the ICU. Current trends in Cisatracurium use. Cisatracurium is gaining preference over Atracurium in high-resource ICUs, and here's why. 1. Preferred in high-resource ICUs. Cisatracurium is increasingly preferred due to its safety profile, minimal histamine release, and organ-independent metabolism. 2. Standard in severe ARDS and ECMO centers. Cisatracurium is a standard neuromuscular blocking agent (NMBA) in many centers dealing with severe acute respiratory distress syndrome (ARDS) and extracorporeal membrane oxygenation (ECMO) because it improves oxygenation and reduces ventilator-induced lung injury. 3. Favored in renal and hepatic failure. Cisatracurium is favored in patients with both renal and hepatic failure because its metabolism doesn't depend on these organs, reducing the risk of accumulation prolonged effects. Research. 1. Comparative studies in ICU patients. Research comparing Cisatracurium and Atracurium in ICU patients shows that Cisatracurium has less histamine-related hypotension. Here's what that means. Histamine-related hypotension. Cisatracurium causes minimal histamine release, leading to more stable blood pressure compared to Atracurium. ICU patient outcomes. A study found similar incidence of hypotension between Cisatracurium and Atracurium groups, 58.7% vs 64.3%. Cisatracurium is generally considered to have a better safety profile. 2. Trials evaluating optimal dosing. Trials focus on balancing the depth of neuromuscular blockade with minimizing ICU-acquired weakness. Key points include dosing and duration. Cisatracurium a longer duration of action, about 47 minutes in children, compared to Atracurium, about 28 minutes. Minimizing ICU-acquired weakness. Using neuromuscular monitoring helps titrate doses accurately to prevent prolonged blockade and potential weakness. Conclusion. On Cisatracurium. 1. Cisatracurium is a potent, predictable, and organ-independent NMBA. This means Cisatracurium is a strong muscle relaxant with effects that are easy to anticipate, and it breaks down without relying much on liver or kidney function. Especially suited for ICU patients requiring prolonged paralysis. Cisatracurium is a good choice for long-term muscle relaxation in critically ill ICU patients. And for surgical patients with cardiovascular instability or organ dysfunction. Cisatracurium causes minimal effects on heart and blood vessels and doesn't rely on organs like liver or kidneys for breakdown. 2. Its reduced histamine release and low laudanosine production give it a safety advantage over Atracurium in sensitive patients. Cisatracurium is safer than Atracurium in patients who might be sensitive to side effects like low blood pressure or problems from breakdown products. Professional quote. On Cisatracurium. Cisatracurium is the refined precision of neuromuscular blockade, clean, stable, and reliable, even in the sickest patients. Critical care neuromuscular principle. This quote highlights the following aspects of Cisatracurium. Refined precision. Cisatracurium provides controlled and predictable muscle relaxation. Clean, stable, and reliable. Cisatracurium has minimal side effects on heart and blood vessels, hemodynamically stable, and is reliable in its effects. Even in the sickest patients, Cisatracurium is suitable for use in critically ill patients, including those with organ dysfunction or cardiovascular instability. Thank you for watching. If you liked this content, don't forget to like to show your support, comment and share your thoughts. Share with your friends and family. Subscribe for more exciting content. Your engagement means the world to us. Stay tuned for more.